So, team here on the call with us, can you explain the significance of the Master Patient Index in enhancing patient safety specifically, and maybe provide some common challenges associated with its management?
Absolutely. One study estimates deaths due to medical errors are the third leading cause of death in the US. Supporting studies and anecdotal evidence shows that some errors are a result of incorrect patient ID, missed verification opportunities, and duplicate medical records. We know patient information changes. The same patient will not have the same name or address or emergency contacts throughout their entire life. Patient data should be confirmed at every visit and changed when appropriate. This allows the Master Patient Index, that master repository of patient information, to follow the patient throughout their clinical care and subsequent admin functions like billing. The MPI has to be right to help our patients get the best care and best possible outcomes. We know people change, circumstances change. We need to make sure that those changes are captured accurately in the MPI. Again, we're also making sure we have the right information while ensuring someone has not misappropriated another patient's identity or insurance information. Identity theft can follow someone around for years, and the critical information entered by patient access is key to prevention. Plus, we're not just helping the patient, we're helping our organization or our office be compliant. We're reducing the risk of insurance refunds, takebacks, investigations, audits, and even sanctions.
Yeah, Lisa, I agree. And I think even when I was beginning, in patient access, things have changed with the Master Patient Index, right? It continues to be our source of truth, but patient access representatives can now be asking things like patients how they self-identify with their sexual orientation and gender identity, and this identification is going to play real important into how the providers get that information and how they treat the patient. It's great to see many EHRs now include self-identification options to help alleviate, LGBTQIA plus health disparities during patient care. And I think the one constant that we see in patient access is things are going to change. And awareness and education around those changes are going to be extremely important. And they're often paramount to patient care and patient safety. Danita, I agree with you with going back to the golden rule, right? If it wasn't documented, it didn't happen. And that documentation is going to be so important for financial and clinical outcomes. Patient status, making sure patient status is accurate. You mentioned clean claims. And all that information that's captured, we can actually limit denials. And then we still have the documentation if we need to, to overturn those denials, resubmit that documentation, it's there. And so the information that the clinicians are using to treat that patient, I don't think it can be, stressed enough that the accurate documentation, complete documentation, supports the appropriate care of the patient.